Good Sunday morning. Thanks so much for joining us. I'm Glenn Mills. It is time to go inside Utah politics. This morning, we begin with Paiute County Commissioner Darren Bushman and Beaver County Commissioner Mark Whitney. Gentlemen, great to have you with us. Thanks so much for being here.
Thanks for having us, man.
Where's your cowboy hat?
I'm allergic to horses. What can I say?
All right. I think I've seen you with one on before.
Maybe once.
Okay.
Yeah.
All right. Let's get into this issue. This is a serious issue.
It is a serious
EMS services across the state of Utah, specifically in rural communities, which the two of you represent. Give us an overall picture of what's happening with the state of those services right now.
Well, right now what's going on is we're forced out of service more than we're in service in a lot of cases. And when we're out of service in a county because of lack of volunteers or personnel to run, then we rely on the neighboring counties, which now puts an undue burden on them. They're struggling to respond to their calls. You'll remember the bus crash in Garfield County. Paiute County was out of service. We had no personnel to send. Our sheriff literally got in an empty ambulance and drove it to the scene. We had EMTs that work out of the county responding from as far as 100 miles away to get there to actually operate that rig.
So, Mark, talk about the impact that has on your area. You guys represent geographically huge counties in the state of Utah.
Yeah, we do. Well, and plus we've got I-15 running right through the middle of our county, and so there's millions and millions of vehicles driving on that road. And a lot of people don't know this, but police and fire protection is mandated under the state code. EMS is not. It's a volunteer type service. It's expected, but it is not mandated. So thank goodness to these good volunteers that we've got in our counties that run these ambulances to protect our lands, not only the people on I-15, but in Darren's County, there's a lot of recreationists in our county that come from the Wasatch Front.
Yeah, we'll get into both of those issues more in a little bit. Darren, let's dig a little deeper into this. Why are we in the state we're in right now?
So we've got a number of things that have occurred. There's a mindset shift away from volunteerism, and people are very busy in their lives these days. I think it takes both family members to make a living. Struggling to get volunteers. To become certified has increased. The time commitment has increased substantially, and the state went to an outside agency, the National Association of EMTs, to certify people. We've really struggled to get people through that certification process. There's just generally not enough people coming in to volunteer to do this.
But there are also budget issues as well.
There are. So the Bureau in 2007 took a pretty major cut to their general fund budget, about 57%. And then there's also a grant fund that's available to local agencies like mine that I think that's taken roughly a 60% cut since 2007. So we're down to about $700,000 that gets distributed across every agency in the state in that per capita thing. And there's virtually no capital grant funds available through the Bureau anymore. So when you're buying a $200,000 ambulance in Paiute County, that's 20% of our general fund budget.
Okay. You already used an example of the bus crash, but in general, what are we seeing the impacts from this? Like, what is an average response time because of the situation we're in right now?
Well, we have long response times anyways. In Paiute County, the closest hospital either way is 30 or 40 minutes, okay? So we have long response times. But our challenge now, and we had an incident just recently where we were out of service. Garfield County was over an hour away. They dispatched Sevier County to an elderly gentleman who had fallen, and he's 40 plus minutes before an ambulance even arrived at the door.
Yeah.
And then he's looking at a 30 to 40 minute transport to a hospital.
So in a life or death situation, that's not a good situation.
Yeah, the American Heart Association says anything over 12 minutes is non-survivable.
So we're talking about rural Utah, but this really is a Utah issue because all of us go down and enjoy time in rural Utah. It could be us at any time. Talk about that, Mark.
Well, again, as I say, rural Utah is literally the playground for urban Utah. That's where a lot of people from the Wasatch Front like to come. We welcome them. We'd love to have them down there. But again, my county is not faced nearly as stagnant on the issue as Darren's County in Paiute. We're lucky we have ambulance services in Beaver, Minersville, and Milford, all about 10 minutes to 15 minutes apart. But still, we have to provide that service, and that service right now is on the backs of our local taxpayers. We've got to come up with some sort of mandated funding that comes from the state to help these counties, especially like Paiute, Garfield, Wayne counties.
That's what I was just
Rural.
going to ask. What other counties are really struggling
Well,
with this?
Wayne County is really struggling, and so is Garfield. Garfield's got a lot better, but it's Darren's county is probably the worst.
Yeah, but it's across the state.
It
we
is.
we held a collective meeting in Richfield. We had 68 regional directors, EMS directors come in. It's across the state. We had Wasatch County, Cache County, San Juan County. They all arrived. They're all talking about the same problem.
Okay, let's move into some potential solutions. One of the things you gentlemen would like to see is moving jurisdiction from the Department of Health to DPS, the Department of Public Safety. Why do you like that as an alternative here?
Well, we think that there's a better alignment. We're talking about an emergency service, right? We're talking about an emergency scenario. That's not something the Department of Health generally does, right? That's not their routine. That is what the Department of Public Safety does. In addition, the Department of Public Safety has a very effective regional structure, a regional management structure, where they're over many of the dispatch centers, the highway patrol centers, and they work with law enforcement agents across the state. Those are also the same exact people that are on these ambulance calls.
I reached out to the Department of Health for comment on this, and I want to go ahead and pull up a response from them. This comes from Dr. Joseph Miner. He's the executive director, and this is what he says. He says, our ambulance and EMT licensing system operates very successfully, but funding to help rural communities purchase ambulances and staff their EMS services was lost in 2008. That $2 million annual funding was lost during the 2008 Great Recession and hasn't been restored. Representative Owen's bill moving the licensing services from our Bureau of EMS to DPS won't do anything to fix this funding problem. Your response to that?
It's not all about the funding.
Exactly.
It's not all about the funding. It's about organizational structure. It's about regional management structure. The Bureau completely eliminated any regional management structure. So we basically have a figurehead organization in Salt Lake City that the EMS directors across the state are in contact with. We believe there is a need for a full-on regional structure to manage this effectively across the state and support those agencies.
And to tie in with that, it's again, you can throw all the money at this you want until we figure a way to get people to want to get back into that field and take the time to be trained of what the requirements are. You know, it's tough. A lot of people don't like to be in this field. It's a tough field to be in.
It is fairly rare, though, across the country, is it not, to have it under a DPS structure?
There are 6 or 8 states that have done this and moved it into their emergency services. We believe it's much better aligned under emergency services, and we have a lot of support for that throughout the state to make that move.
Okay. Dr. Miner also went on and kind of talked about some of the possible solutions they've thrown out there. One of them being a small fee on different motor vehicle registrations, using a transient room tax, or making ambulance and EMT services essential services. I know you support the essential services part, but what about those other ideas?
Well, and again, we like them, but what we want to make sure is that we come up with a statewide solution and a statewide fund that'll help segue the funds to rural Utah, because we're having to take care of a lot of the urban state. We do not want this burden mandated on our local taxpayers.
One of the issues, people think that this is a money-making opportunity,
Exactly.
and from the Bureau themselves, they estimate $30.7 million was lost by servicing agencies in the state. Okay, that's their estimate. So agencies like mine, Mark's, you know, I realize as constituents get a fairly large ambulance bill, it's painful, but at the end of the day, across the state, we've lost $30.7 million in the agencies. We all have to report that to the state.
Okay. Go ahead, finish that thought.
So there has to be a funding model. We've looked at a bunch of different funding models, and Representative Owens has 2 or 3 options he's looking at with his bill to provide a substantial amount of funding into the Bureau which it really needs.
Okay, and that would be through potentially rural hospital taxes, et cetera?
So there is another bill Representative Lyman is running,
Mm-hmm.
which allows fourth-class counties to use the rural hospital
Okay,
tax.
real quick, we have less than a minute left, but I want to get on this point. You brought it up earlier, making this an essential service. Talk about why you think that is vital.
What my opinion on it is nobody is responsible for EMS right now. It's being done, right? It's being done in some cases by counties, some cases by municipalities, some cases by nonprofits, some cases by hospital. As we go to municipalities, if a county is providing the service, the municipality has no obligation to participate. And the same goes where the service is being provided by the cities, the counties have no obligation to participate. We need the whole entire team on the field.
Okay, we're going to have to end it on that note. Gentlemen, great conversation. We'll watch how this plays out through the legislative session. Always glad to have you on the show.
Thank
for
you.
Thanks so
coming
much.
up.
Thank you.